Hello friends. Do you have patients who have difficulty in falling asleep or have excessive daytime sleepiness and are suffering from underlying cirrhosis? Are you actually taking care of it or just ignoring it? Let's talk about sleeping disorders in patients of cirrhosis. Now, as a result of cirrhosis, we all know that there are a lot of metabolic abnormalities, hormonal changes, as well as electrolyte disturbances that precipitate sleeping changes. And as a result of this, all patient has difficulty in falling asleep. Also, they have difficulty in staying asleep and have multiple times waking up. And there is also long daytime sleepiness or prolonged day sleepiness, which is known as excessive daytime sleepiness. The most common reason why this is associated is change in melatonin hormone. Besides, patient also complains of restless leg syndrome and also have muscle cramps. So if you have any patient who suffer from sleeping disorders, please do not ignore it. There are now good watches and actigraphy available which can tell about the patient's sleeping routine. So if somebody is suffering from sleeping disorder, try to improve their night hygiene. Avoid caffeine at night, have a fixed sleeping time. Also, allow them a calm, cool environment for them to sleep. If it fails to improve sleep quality, then there are drugs available like melatonin, and there are prescription drugs available, and there are newer agents which are into the Indian market as well, which can be utilized safely even in patients of liver disease. Besides, if there is muscle cramps, they need to avoid dehydration, they need to correct electrolyte imbalances. If there is restless leg syndrome, then it needs to be tackled as well. One of the important reasons for poor nighttime sleep is excessive daytime sleepiness. And one of the major reasons of excessive daytime sleepiness is hepatic encephalopathy, which is not overt and which cannot be picked up easily. In those circumstances, we need to actually treat hepatic encephalopathy with the available agents in a much better shape so that the patients can develop a better good sleep. So if there is a patient of sleeping disturbances, we should not ignore it. It worsens their quality of life, and rather we need to deal with it conservatively with medications, treating hepatic encephalopathy, treating muscle cramps, treating restless leg syndrome, and if required, taking an expert help as well. Thank you.